Surrey's A1 apparel and promotions, t-shirts, jackets, caps, flags, badges. ਇੱਕ ਨਹੀਂ ਅਸੀਂ ਕਈ ਇੰਟਰਸਟਿੰਗ ਤਰੀਕਿਆਂ ਨਾਲ ਤੁਹਾਨੂੰ ਕਰਦੇ ਹਾਂ ਹਾਈਲਾਈਟ ਤਾਂ ਕਿ ਮਾਰਕੀਟ 'ਚ ਇੰਟਰੋਡਕਸ਼ਨ ਦੇਣ ਦੀ ਲੋੜ ਹੀ ਨਾ ਪਏ। ਸੋ
ਅੱਜ ਪੰਜਾਬੀ ਪ੍ਰੈਸ ਕਲੱਬ ਦੀ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਦੇ ਵਿੱਚ ਕੈਨੇਡਾ ਦੇ ਫੈਡਰਲ ਹੈਲਥ ਮਿਨਿਸਟਰ ਮਾਰਕ ਹਾਲੈਂਡ ਆ ਰਹੇ ਹੈ, ਜਿਹੜੀ ਕਿ ਇਹ ਮੀਟਿੰਗ ਪੰਜਾਬ ਬੈਂਕਟ ਹਾਲ ਰੈਸਟੋਰੈਂਟ ਦੇ ਵਿੱਚ ਸਰੀ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ 'ਚ ਹੋ ਰਹੀ ਹੈ। ਇਸ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਦੇ ਵਿੱਚ ਨਿਊਲੀ ਇਲੈਕਟਡ ਔਨ ਜੁਲਾਈ 26, 2023 ਮਿਨਿਸਟਰ ਆਫ ਹੈਲਥ ਮਾਰਕ ਹਾਲੈਂਡ ਆਪਦੇ ਰਿਮਾਰਕਸ ਦੇਣਗੇ ਅਤੇ ਉਸ ਤੋਂ ਬਾਅਦ ਪ੍ਰੈਸ ਕਲੱਬ ਦੇ ਮੈਂਬਰ ਜਿਹੜੇ ਹੈਗੇ ਆ ਉਹਨਾਂ ਦੇ ਕੁਐਸਚਨ ਆਨਸਰ ਦੇਣਗੇ ਅਤੇ ਅਸੀਂ ਸਾਂਝਾ TV ਦੀ ਤਰਫੋਂ ਉਹਨਾਂ ਦੇ ਪਰਸਨਲ ਕੌਮੈਂਟ ਵੀ ਲਵਾਂਗੇ। CJ Sidhu reporting from Surrey, British Columbia, Canada.
To Surrey and especially to Surrey Newton out here, and also welcome our Member of Parliament Sukhtalwar. This is your riding, so and you are not new to Punjabi Press Club, so we welcome you every time you come and bring a new minister. We are more than happy. So please continue this tradition. And Minister, you are welcome. Anytime you visit Vancouver, please come to Surrey. There are, about 10, 12 ridings in Surrey. This is going to be the second largest city in BC, and it will be the largest in the next 5 years or 10 years. They're giving it 10 years to be the largest. Just forget Vancouver. So make your mark now in Surrey.
And unofficially it might be, because there are a lot more people living that are not on the statistics list. Right?
Okay. Our agenda today is just a very short one, which would be first of all the introduction of the members of the press, and then introduction of the minister by our Member of Parliament Sukhtalwar, and then we'll have remarks in detail, not small, from the minister on the various issues affecting Canada, but particularly affecting BC within his ministry, and what he's here for, what issues he's going to be dealing with, the message that he wants to get out to the people. You are represented here with a vast array of media outlets that are here in the Punjabi community or the South Asian community there, and then we'll have, if the members have any questions, and after that it was going to be a group photograph, but if any new member comes, he can get a photograph done, and then it will be one-on-one with the various radio stations and the TV stations out there, and we assure you we'll let you go as promised by 11:15 from here, as you have a flight to catch. So with that, I'll start with the introduction from that side.
My name is Purvi Devan. I work with the Satchariwas newspaper and newspaper Times.
This is Damanjit Kaur, freelance, working with Satchariwas and others.
Amarpal Singh, Canadian Punjab Times newspaper.
Sandeep Sanjha, Daily Ajit Punjab.
Sukhdev Singh Talal, Radio Punjab. Oran Singh, Radio Punjab Times.
Sarkar Singh Kalon from Radio Punjab.
Santosh Singh Mandel, international sports photojournalist, working with Indo-Canadian Times locally here. Thank you. Thank you for coming.
CJ Sidhu, Sanjha TV.
Baldeman Red FM.
Paul Gill, secretary of the club and representing Satchariwas newspaper. With that, now I will request our Member of Parliament Sukhtalwar to introduce the minister.
Thank you, Bir Kashpal. I would not call you Mr. Gill because, it's a long relationship, like a brother. Even with everyone here, like I have kept my personal relationship with you, but at the same time, I have never came to any of the media to cover me in a positive or negative way, whatever it is. You have been very constructive, not only with me, in fact, when it comes to dealing with issues. Now, before we start, I'm very honored actually and privileged to sit along with with the minister, because today he's the minister, but if I go back, first he got elected was in 2004. The riding at that time was called Ajax Pickering, as mine was Newton or Delta at that time. So they took Pickering out, and then since 2015, the riding is called Ajax. And there are two most important portfolios beside the ministry and the Prime Minister, of course, in the caucus. Number one is the whip, right? Everyone knows that there's a one person that disciplines and everybody listens to. And my dear friend and brother-like friend, Mark Holland, was whip. And then comes the House Leader, because House Leader is the one that sets up the agenda for the House, and Mark Holland also did that. And eventually, he became the Minister of Health. The Honorable Minister, when it comes to Surrey, like, he's very, very open-hearted person, always works hard, on the go, and most importantly, if there is few of them, I can count on my fingers that I call them my friend. Mark is one of them, and Mark is a dear friend. And today, Mark, welcome to the beautiful Surrey, Newton.
Thank you so much. Satsrikal. I want to say, first of all, just to Suk, who over the last 20 years has been such a dear friend and like a brother. I've learned so much from Suk. He's such an incredible person of passion who gives to his community. In Ottawa, Suk is always advocating for Surrey, always talking about what's happening in his community, always talking about what's happening in British Columbia. As such a powerful advocate, and I just really want to thank you for your friendship, Suk. I wish my Punjabi was stronger. I did go at our local Gurdwara for about a year to Punjabi lessons. So I learned, Gaga, Nana, Sasa. I learned how to write everything. I wish I had done it more. So I have a little bit, but unfortunately I have to address you in English today. But I want to say a couple of things. First of all, what an exciting time it is for Surrey. To see this explosive growth and what a dynamic international place Surrey is becoming. I think it's becoming known as a place of innovation and creativity and business and really driving tremendous growth in Canada. And with growth comes challenges. Now, challenges of growth are better than challenges of atrophy, but they are challenges. And we know those challenges are real in areas like healthcare. I just had an opportunity yesterday to meet with Minister Dix and talk about Surrey specifically and the needs of health of Surrey, but also of British Columbia. And one of the things, of course, you would know is we signed an agreement with British Columbia and across Canada to put more than $200 billion new dollars into healthcare. And that's coming with the commitment, not just that there's new money, but improved outcomes. And what we're going to be launching very soon here in British Columbia, and I would love to be able to do it here in Surrey, is the action plan for British Columbia for health. The opportunity to talk about how this new money that's coming into health is going to improve patient outcomes, it's going to reduce wait times, it's going to improve health care, is going to make sure that we tackle the issue of workforce. These are complicated issues. Now, there are some, like Polyev, who are going to tell you, oh no, snap a finger, it's all fixed. But we know what the Conservatives did when they were in power. We know what they will do again. Healthcare is not going to be fixed by cuts. It's not going to be fixed by slashing funds. Healthcare is not going to be fixed, as an example, by cutting the dental program that we're now introducing across the country. Already that dental program, which is just at its start, has helped 350,000 children have dental care that maybe never had dental care before in their life. That's almost 30,000 that have been helped here in BC already. That is just the beginning. By the end of this year, we want to see it rolled out for youth and for seniors. And by next year, we want to make sure that every person in this country has access to dental care. That's absolutely essential. And of course, it would be gone under a Conservative government. We know there are challenges with housing. Those challenges do come as a result of of the growth we're seeing. But again, you aren't going to fix the problems of housing by insulting municipal governments and cutting funds. And you certainly aren't going to fix it with magical wands. We're here, and Suk's here, and you know Suk. Suk is somebody who does the work, who shows up every day and does what needs to be done. Making progress is hard work. It isn't easy. On dealing with issues like credentials, we have to work with every level of government, every territory, and we are. And one of the things about this action plan is we're putting dollars and plans to really address the issue of credentials, but to do it in a way that's honest and real and works with the other provinces and the other jurisdictions that we have to collaborate with. So wonderful, exciting things are in store here in Surrey. We are so happy to be wind in the sails of those great things. And I'm so excited to take on this challenge of being health minister to help meet those challenges of growth and make sure that the best health of Canadians prevails as we move forward. So happy to take your questions. If I believe that's the format we're going to go with, Paul.
Yes. Okay. Thank you, Minister. Okay. For questions, the first question we'll keep the questions short and the answers too brief, but don't leave anything out.
Koi gal nahi.
Okay. And you know, as we have it, we'll try with one question each, and if we have time, we'll go around for the second one. Okay. We'll start with Amarpal.
Yeah, as you said, like the community is growing here, right? And lots of people are facing problems, health problems. Because I'm still confused why this situation happened, because there's a community growth and government knows that there's lots of immigrants coming, and without infrastructure, then why the government do it? And plus is due to the inflation increase and interest rate increase, people are going in anxiety, stress problem, panic attack, right? And I'm saying like why the government do that things, the people go in and stress and problem for the health, right, health sector.
So great questions, Amarpal. I thank you for them. So let's first step back and talk about why we need to bring new people to Canada. We need to bring new people to Canada for a whole host of reasons. One of them is that we have an aging population. Right now we have about 3 people working for every person retired. It used to be 5 people working for every person retired. We're going down to 2 people working for every person retired. And if we're going to have the kind of benefits for our seniors and the kind of services and infrastructure and health care, we need workers, and we need people of an age to work to support us. The second concern is that when we have a booming economy, we also need workers to support that economy. We need to build the infrastructure, you're absolutely right, the roads, the schools, the hospitals, but we need people to do that. And right now, particularly in the skilled trade and in construction, we need folks who are going to be able to build those homes. You know, there is a choice for this country. We can grow and meet the challenges of growth, or we can slash and we can cut and we can shrink. And I can tell you that we can rise to this challenge of growth. And you're seeing it here in Surrey. It's challenging to grow as fast as Surrey is growing. It's challenging to see this explosive growth in Surrey emerging in the world as one of the great centers of the world. But we can rise to that challenge. The answer isn't slashing and cutting and being smaller. The answer is making sure that we get the infrastructure right, which is why, specifically on healthcare, we're putting in all of this additional money, not just dollars, because I think we really have to see, this is why it's so important to get to this action plan. The action plan that we're going to announce in the coming weeks with the province of BC is about partnership. It's about identifying exactly how we're going to improve our healthcare system, exactly how we're going to get to a better state. Look, we went through something incredibly traumatic with the pandemic, and it scared us all, and it was very difficult, and it put huge strain on our health system. But underneath that, as I go and I talk across BC, folks in industry and folks in the healthcare sector, we're ready to meet these challenges and be stronger and better than we ever have before, and really focus on not just healthcare, but prevention. Making sure that we avoid people getting sick in the first place, which is what dental care is all about, and some of the investments we're making elsewhere in prevention.
Before I ask Daman with the question, I just want to mention we have been joined by Perneet from Red FM.
Thank you so much.
Good morning, Minister, and welcome to the city. I hope it's not your last visit. We hope to see you more in the future. You were talking about the healthcare system and your efforts to make it better and improve it. But there is a situation which is already existing in the system, in the present system. It is the unintentional harm in Canada's hospital, which is on rise. So according to Canadian Institute for Health Information, in 2021 and 2022, 1 in 17 hospitalization ends up in experiencing a harmful event which requires further prolonged treatment. It could be any harm or misdiagnosis. How can we improve this existing situation in our healthcare system?
Thank you so much for the question. And on your first point, 100%. You have my guarantee. I'm going to be back to Surrey very soon. Surrey is incredibly important to this country. It's incredibly important to the economic story of this country. The growth that we're seeing here is absolutely critical. And so being here, meeting with you, talking with you, being a partner with you, you can count on that. On the second point, you're absolutely right. We have to, when we're working with provinces, and remember, as a federal government, obviously a lot of this is in provincial jurisdiction, but nobody cares about that. We want to see better health outcomes. And what these agreements are about is letting people see in numbers, in data, how we're improving the health system. So having markers, and this is what we're doing in partnership with CIHI, where we identify the various markers of what constitute a strong health system, and then be able to see empirically how that's improving over time, how the investments we're making in health are having a real difference. And in terms of what you're talking about, these harmful events where people have bad patient outcomes, that's also what this is about. It's not enough that the numbers say that we're seeing improvement. We have to ensure that people are feeling that improvement and feeling that difference. And, you know, as an example, I had a great conversation yesterday at St. Paul's. You know, they have a super cluster there where they're investing in research, and they're talking about one of the biggest problems we have in hospital is with wounds. 30 to 50% of patients have a wound, and that wound ends up festering and creates the kind of bad outcomes that you have. Well, during the pandemic, there was an app that was developed that allows you to take a photograph of that and have that be uploaded and digitally diagnosed at a fraction of the cost and a fraction of the time to identify what needs to be done and to intervene immediately. So there's incredible solutions that exist, not just with dollars, not just with reform of the health system, but with technology. And what I think Canadians want is for every level of government to come together in partnership with one purpose, and that is improving the health of this country. I think people don't want to hear whose jurisdiction is what, or, you know, that's somebody else's problem. We have to get to the table where we have a meeting of health ministers that's going to be happening in October. We have to come together and say how we are working together, set aside our partisans, set aside our differences, set aside our egos, and say how are we doing this. And that's what these plans are about. The action plan we're going to announce is about helping to see that improvement. Are we going to fix it overnight? Of course not. But what people want to see is progress, and that's what we're ready to deliver.
Thank you so much for answering that question. I'm glad to hear that you're not collecting further data, but actually taking action. Thank you.
Thank you.
So much.
Okay, our next question is coming from Daman.
So first of all, we have lots of hope from you because you have represented as a true leader, I would say, since 40 years or 20 years, sorry, right? But when we talk about healthcare, so you have seen that it's not little imbalance, it's more imbalance we can see in healthcare. Problem is, if we talk about newcomers, 70% of them, they are struggling to get a family doctor, family physician. Emergency care, wait time is, if person goes there, it's almost 18 hours, they have to sit there, even if it's a case of emergency. So other things, when we talk about, you said you will make a plan of action, but the thing is, healthcare is something, you will give funds, infrastructure, funding, credentials, everything is long term. You can get result right away. But you know, looking at, if you are familiar with the news that a lady went to emergency, they didn't have a bed for her, she delivered a baby when she was coming back to the house in the car. So that is a real situation. So obviously we need immediate solutions. So I just want to know that in your plan of action you have funds, you have infrastructure, everything, but that's going to take time. So what you see as an immediate solution for healthcare? Because we have a lot of, foreign doctors here who are in the process of credentials, because it takes a lot of time for licensing here, you know that. But they are not into this profession. So we can't say that we don't have a trained doctor, but credential process is also lengthy. So do you have any plan easing that process?
So first of all, thank you for your question, and let me acknowledge the truth of what you speak, which is that so many Canadians, and especially new immigrants, are facing challenges in finding health care, and that situation is unacceptable. It is a situation that we're seeing across all of our peer countries. The pandemic was extraordinarily difficult. It put enormous strain on our healthcare workers, and we're having a real tough time asking people who carried literally, houses up mountains, saying that, we got to get you to keep working. We need you to keep pushing and keep going. It's a lot to ask, but there are, when I meet with doctors and I meet with nurses and I meet with healthcare professionals, they are some of the most incredible people in this country who entered that job because they have a genuine care for people. And what they want more than anything else is to know that they're going to be supported and that help is on the way. And it is. And I think there's a couple of things that I would say. The first is that the action plans that we're talking about with provinces focus, one of the pillars is workforce, is bringing more people to the table. And there's a lot of ways that we can do that. Certainly, there's the pathway of credentials. Now, we have to be honest about that. Credentials isn't just a matter of snapping our fingers. We have to make sure that there's appropriate recognition of those credentials and that people are qualified to practice within the province of jurisdiction. But I think we can do that working with provinces and working with the bodies that are responsible for recognizing credentials. It's a complicated map, but I think we can get there working a lot more closely to see those barriers reduced and to see that happen much more quickly so that we can get the capacity that's in the country moving as quickly as possible. The second piece that's a lower hanging fruit piece is mobility. It makes no sense that somebody who is certified and recognized to be, that their credentials are recognized in Ontario and they move to a different province or is recognized in BC and they move to a different province, has to sit around for months not practicing because they're not being recognized. Now, some provinces have taken some different approaches. In my home province of Ontario, as an example, they say you can practice at day one, and then they're going to recognize your credentials in the background. The Atlantic provinces have done different things, but we need to make that really harmonized across the country. We need to see no barriers, because it is so frustrating to have healthcare professionals sitting, waiting, who have already been approved and licensed in other parts of the country. Immigration is certainly going to be part of that. And so too is the work that we're doing with students. Our loan forgiveness program, particularly for those working in rural and remote communities, to incentivize them to say that they're not going to have any student debt if they work in a rural or remote community, is a really critical lever as well. But I think we have to go back to another point, because we are in an inflection point where Canada is growing tremendously, and like all countries coming out of the pandemic, we have serious health challenges. If you ever arrive at the bottom of a mountain and somebody tells you it's going to be a long walk and a long climb to get to the summit, but we can do it because here are the steps we're going to take. And then another person comes next to you and says, you don't have to do that long hike. You don't have to climb that mountain. I have a magical machine back in the forest, and you can walk into it, and it'll just teleport you to the top. And you can avoid all of the hard work, and you don't have to do any of these hard things. That yes, everybody else has climbed the mountain by climbing it one step at a time, one foothold at a time, but that there are easy ways. We know what that has meant historically. What you're going to always have with me as health minister is to tell you the things that are hard, straight, the things that aren't working, true, but I'm going to tell you why you have enormous space for optimism and why what's happening in our health system is extraordinarily positive. Against the backdrop of the challenges that we have, I was at the Children's Hospital in BC just 2 days ago, and I know, Suk, you know this as well, going into the oncology department, speaking with a woman who worked there for 30 years. When she started there 30 years ago, the survival rate for a child walking in there was 30%. The survival rate today is 85%. The wait, if you were a child with cancer in BC, is 0 minutes. The cost for a family with a child with cancer is $0. Yes, there are things that aren't working. Yes, there are things we have to improve. But by God, walking into that cancer ward and seeing the faces of parents who are going to see their children live and have children, see their children grow up and get the chance to have grandchildren, 30% to 85%, let's not lose sight of what we're winning. Let's not just focus on the challenges and the things that are hard. Let's also focus on the things that we can celebrate and we're doing well.
Mr. Can I add something?
Please, Sue.
Daman, I bring it home. As you probably know, both of my daughters are physicians. You know, one of them is a family, the other one is a neonatologist, which Minister talked about saving children, premature. When my daughter moved, he's absolutely right. She moved from US, Ivy League University, that's where they did their residency. When they came back, she had to wait, one of them, the family physician had to wait 6 months to start her practice. And she was getting depressed and wanted to go back to US. But because she was patriotic to come back to study, and she did survive. And different orders of the government have to work together. Prime Minister and Minister Evie had a press conference at KPU where we brought in a nursing program, put additional dollars in, so they are given a year of training and bring their credentials up to speed so we can bring them into workforce. Family physicians, 7,500 family physicians that we are also put resources aside so we can bring more family physicians and particularly places like Surrey, which is the fastest growing municipality with 1,500 people moving every month. So we are there.
So we hope that that would be your priority because we already have supply, but we are not able to use that now.
Yeah. I mean, look, I think there is, and you're going to see this as we roll out the action plans, that there's great opportunity to make early progress and to start to see improvements, and to do that one step at a time, to ensure that we have the best health care possible for Canadians. That is largely going to be delivered by the provinces. Like, let me be clear. As I speak with all of this optimism, these are services delivered by the provinces. But what you're hearing from me is we want to be partners in that. We want to be wind in the sails of the provinces. We want to work with them to create the action plans to help them actualize these improvements. And we want ourselves and provincial governments collectively to be accountable in data. But there's a saying in law, right? It's not just important that justice be done. It's important that justice be seen to be done. And that is what's essential in health as well. We want to show it in the numbers, but then we want to make sure that people feel it in the outcomes. And just the last note on this is, despite, and this blows me away, despite how much our healthcare workers have had to carry, the trauma that they went through of carrying us through the pandemic, and saving hundreds of thousands of lives in the work that they did, there is huge energy for this challenge. They see the potential that's there in our health system, and they're ready to deliver.
Okay, well, next question is from Mr. Santosh Mande.
Yes, sir. Honorable Mr. Mark Holland, welcome to the Punjabi Press Club. We appreciate your efforts. But your healthcare system is not a healthcare system. It's a sickness care system. You care when the people are sick. I recommend there are a lot of physical fitness and sports persons in the community. You must look them, and they have to, they are ready to take the subsidy. They are working in different fields. Why not you should involve them in a physical fitness or healthcare system? They will give you the better results. Thank you very much.
Thank you, and I think this is an excellent point, and I really appreciate you raising it. Because it really gets to a core of what we have to think about, which is that healthcare is all of our responsibility, and how we ensure. Like, I was at Heart and Stroke where I was the executive director of Ontario. I was the national director for children and youth. And what do we know about heart disease and stroke? 70% is preventable, right? What do we know about cancer? Around 70% is preventable. Most of the things that bring people into a hospital are preventable. And yes, we have to talk about physical fitness. Yes, we have to talk about nutrition. But working with Yara Sachs, we really, and with Suk and our caucus, we have to go after mental health. You know, telling somebody, hey, you got to go exercise, if their mental health is not in a good place, isn't going to work. Telling somebody, hey, you should, you know, eat some vegetables, if they're having terrible mental health struggles, is not realistic. What we know is that mental health is at the core of prevention. I've tried to talk about my own story with mental health because I think we all have to have a more open conversation about just how hard it is to be a human being in the world today. And when we can share those struggles, we can support each other. And how do we support each other? With empathy, with kindness, with understanding, with knowing that what we're facing is hard. Not with anger, not with finger pointing. You know, one of the things for me is, and I'm sure you experience this in your own life, there are people who are always trying to be positive, always trying to lift people up, always trying to see the positive side of things. You know, they acknowledge what's bad. They're not foolish, but they try to say, yes, this is bad, but we could do this, you know, or yes, this is tough. And then there are people who, oh, give up. No, forget about it. We can't do it. It's all bad. You had a bad day today, wait till tomorrow, right? We can't do that to each other. You know, we have to be fundamentally optimistic. So I kind of am going very high, but let me get specifically to your point around physical education or physical activity. We have a minister who's specifically responsible for more than sport, but for physical activity. And we have to work very closely in health with that. And I'm a huge believer in getting active and the power of sport. And I know that Carla Qualtrough, who's here from BC, who, by the way, is a former Paralympian, is hugely passionate about this. And it's something that we have to work on closely together. The prevention side of things is profoundly important to me, and I hear your point. I completely agree with it. I take it back to the mental health piece because we have to work on that at the same time, right? You're not going to get a kid to get physically active and be in sport if they are in a very dark mental place, right? So we have to recognize the push and pull of that. Yeah.
Okay, we have got CJ, Dr. Poolan Singh, Balbir Kaur, and Kuldeep Singh, and we have 15 minutes. So please keep your questions brief and answers brief. CJ?
Welcome to Surrey, Minister, and it's very nice to have an open conversation. And you know, we're very blessed to have a universal healthcare system. Like you said, we have to be positive about what we have rather than complaining about what we don't have. Having said that, we have challenges, like you said. So my colleagues already asked the questions, I will not repeat those. But mental health issue you alluded to right now. The opioid crisis is a huge. In British Columbia, we're losing 6 people a day. And you're losing even one near and dear one. And it crosses all boundaries. Color, race, religion, and mostly youth. So that's my one question. And my second question will be a very simple one. While we're having a universal healthcare system, how you feel about our government sending patients for radiation therapy across the board? Are they touching upon our universal healthcare system? What are your take on those two issues?
Thank you, and I'm aware of time, and I've been the culprit. You guys have been very restrained in your questions, and I haven't been nearly as restrained in my answer. But I'll try to go quickly. So, but this is a fundamentally huge issue. Look, let's recognize that by the time somebody is addicted to opioids, we're way too far down the track. And there are things we can do once somebody is addicted to opioids, but really that can't be our strategy. We can't wait till somebody's addicted to opioids before we take action. We really have to look upstream and have honest conversations about why somebody turns to self-medicate in such a self-destructive way. And you know, nobody is taking opioids recreationally. You know, this is because they're self-medicating. And there's no coincidence that often the people that are facing the greatest challenges with respect to dependency of extremely dangerous drugs are people who are the most vulnerable, who have faced racism and discrimination, have faced ostracization, feel that they don't have a place in our country, that they aren't valued, that fundamental sense of self-worth. You know, building community supports. You know, within the Sikh community, so much is being done to help youth and build them up and help them see themselves and be proud of who they are. That's so fundamental, right? And attacking that and understanding why a young person would not feel confident in their own skin, you know. It's, and that really is about community support. It really comes down to understanding in every community, because the challenges that are faced with opioids, you're absolutely right that every community is facing this. It is totally blind to you know, race, religion, you know, any consideration, gender. But what is true about it is that why it's a problem, why people are making that choice to get addicted to opioids is different in every community. In my home community of Ajax, you know, I'm very sad to say we have a problem as well. And but that problem looks different and its solutions are different than what's in Surrey. And so we have to, at a community level, support science and data to deal with the problem as it exists right now for people who are addicted, and follow science and data and not emotion, right? And then secondly, we have to go upstream and kill the causes of why this is happening. And there is no coincidence that the increase in problems with mental health are directly correlated to the problems with opioid addiction. The more we have problems with mental health, the more we have problems with drugs. And that's why I come back to the work that Yara and I have to do with the provinces, with communities, to tackle that issue of mental health. It's so critical to the challenge of opioids. On the question of, and I've already broken my promise and spoken way too long, but I will say on the question of universality and making sure that people have access to the best and highest quality care here in Canada, absolutely. That is a fundamental tenet of our health system.
And what do you think British Columbia is sending people across?
Well, I think, you know, I can't comment on provincial jurisdiction. I can only speak on the basis of a federal framework. And on a federal framework, it's the, you know, we want to make sure that care is available here in Canada at the highest and best level.
Okay, next question is from Dr. Pugan Singh.
That's my personal experience. I had to wait for 2-3 years to be diagnosed. And I was fortunate to be admitted in the hospital. Then they found that I was suffering from autoimmune disease. The second is my relative died because of cancer, lung cancer. Here she was not able to get an appointment. Then she had to go to India, get MRI. Then they recognized that it was too late. It's happening. Can we have two-tier system if someone can afford to have a test or PET scan?
First of all, I'm sorry for your experience. I'm sorry that you had to wait as long as that you did. And you're absolutely right that a delayed diagnosis can be fatal. And the answer, though, is, in my view, a public system. And the reason, in making that public system work and putting our whole shoulder to it. The problem with a private system is that immediately you create two tiers of healthcare. You know, for a nurse who is on the front lines of healthcare, to not be able to afford the best and highest level of care because she doesn't have enough money in her pocket for the service, that's just fundamentally unjust. You know, we shouldn't have to choose whether or not we get good health care by virtue of whether or not our job pays a lot of money or not. And we all know that there are jobs that pay a lot of money and there are jobs that don't pay a lot of money. And that isn't necessarily correlated to how hard somebody works. You know, a nurse doesn't become a nurse because they want to make a lot of money. They become a nurse because they want to help people. And we don't want to leave them behind. And I don't want to live in a country where a nurse who's breaking their back, his or her back, taking care of people, can't get access to the best care themselves and for their families. So, I know it's tempting sometimes when we're frustrated with some of the weaknesses in our system and as we're working through to fix them to think, oh, just let's create another tier, let's create a private. But the moment you create a private tier, then you're saying that there's a different level of care for those with money than those without. And I just think that breaks a fundamental value that's Canadian.
Thank you. Okay, the next question is from Balbiko.
So my question was already answered. So my daughter was concerned about the healthcare system. She asked me to ask a simple question. She said many patients are being able to get treatment fast enough and end up losing their life because our system, we don't have space in the hospitals. And understaffing is a huge issue, so would the hospital consider hiring someone with OFA level 3 or level 2 to help identify, to get staff to get the most critical patient faster? With the long wait in the waiting room, staff is not able to truly understand the full extent of the patient's priority just from intake. All they can do is take vital temperature and ask what's wrong. So is there anything, like I know we are shortage of staff, we don't have nurses or doctors. Can we include those emergency responders to the staff as well?
So first of all, thank you, daughter, for the question. I appreciate her sharing that through you. So this is fundamentally a provincial question, but further to my earlier promise, I'm not going to avoid a question just because it's not my jurisdiction. What I will say in the broadest sense is during the pandemic, we had to be really innovative about how we delivered healthcare solutions. So as an example, folks in the tourism sector had to be deployed to deliver vaccines. We had to think about maybe do we use a dental hygienist who has, expertise in a medical space to be able to deliver certain services that they would have expertise to. I think we have to break down these barriers, and I think in the conversations I'm going to have with my provincial counterparts, asking how we can deploy different existing resources that would have the experience and ability to take pressure off of the health system and use different experiences is something I'm extremely open to. So I would say to your daughter that the answer is, these are exactly the kinds of conversations we're having. How can we move some of this stuff off the shoulders of the existing healthcare workers onto places where there is more capacity, and also use technology, use all of this. I talked about the app around wounds, but there's so many examples as well where we can use virtual care or we can use different types of technology to help alleviate that burden as well.
Thank you.
Okay, we have Dr. Kuldeep Singh and Sobraj. It's okay, 60 seconds for the question and 120 seconds for the answer. I'm getting signals from the anesthesist. Kuldeep Singh.
Thank you. Just like Sok was telling that his daughter have to go abroad to get education in medical. More than 500,000 immigrants are coming here. Comparison to that, how many professional medically we have hired in Canada? Especially those people coming as a doctor in this country, they are driving taxis. I have a daughter-in-law. Her professor, she was teaching 14 years dentist in Punjab. But here, there's no chances for him. He has to go to US. A lot of kids are going to US for study. When they're going to get a medical study, they don't want to come back here because they're getting better package. How we can improve that medical system so that we have more schools. Those credentials you are talking about, those are the College of Physicians. They don't want those foreigners to come into Canada. So that, is there any way that you can make a different way? Because those professionals could be recognized here in this country and we have more schools, only two.
Thank you so much for both of those questions, Doctor. And I know that Suk and Randeep are working very hard with UBC to try to locate a medical school here in Surrey. And again, this is kind of moving outside of jurisdiction, right, and trying to be a team player, because this is not necessarily federal jurisdiction, but it's the kind of leadership that Randeep and Suk are showing. I think on the question of schools, yes, and it's part of that plan that I'm talking about. And I know it's a bit frustrating because the action plans aren't out yet, but what you'll see in those action plans, all of the questions around workforce, including students, are really what we're going after, and the question of credentials as well. That your point is very well taken. We need to find the fastest, most expeditious way to work with provinces and with the bodies that are responsible for recognizing credentials to vastly accelerate what's happening right now. Now, that's complicated. It isn't, part of why it's complicated is it isn't one jurisdiction that's doing it, so no one jurisdiction has the keys, but you rightfully expect that we're all going to work collaboratively to find those solutions, and your point is well heard and being worked on. Thank you, Doctor.
So, Sanjha,
so the last challenges faced by minority communities accessing quality health care. So specifically Punjabi elderly people, they face a bigger challenge of language barrier and cultural sensitivity. So as a federal counterpart, how do you intend to work with provinces to solve this problem so that diverse communities, they get proper and accurate healthcare information and care?
Yeah, thank you. So this does again go directly to an area of provincial responsibility because it's directly in the application of healthcare. But we provide a lot of services at a federal government to help connect people to government services and to support folks integrating. And I know there are enormous challenges, as you're saying, around language or barriers to access by not understanding a Canadian system as well for folks who are new, or even folks who've been here a long time, but the system is extremely foreign to them. So, that's an area that within the work plan, we have really that question of accessibility. Usually when we think of accessibility, we think about it in terms of rural and remote communities, but accessibility really comes down to all of the barriers to access. So when we talk about the dental care program as an example that we're rolling out for every Canadian by 2025, that program has built into it provisions around accessibility specifically to go after some of the issues you're talking about. Because it's not enough that the service is available. The service has to be accessible. And accessibility isn't just a concern for rural and remote. It's also a concern for, as you say, language barriers or other potential barriers that we have to break down. We were talking about that for Indigenous. Had an announcement yesterday around sexual and reproductive health for Indigenous communities, and looking at how big those barriers are. They're not just the fact that so many Indigenous folks live in remote communities where they don't have access to these services. There are a lot of barriers to them getting that service that aren't just about somebody being there. So we have that accessibility built into the work plans as a fundamental part of our thinking of how we deliver healthcare.
Thank you, Minister, for coming out to Surrey. We have only run over by 2 minutes, and now there will be time for, so I'm going to request that we go with the radio first 3 minutes each, as they have to beat the deadline for putting their sound bite on the radio, and then the TV stations, they'll get 5 minutes each as the minister has to leave by 11:15 out of here. So what I'll suggest is, why don't the radio and the TV move to the front, and the rest of us will move to the back and grab our coffee and keep our voices low, so that they don't interfere.
And I can recommend the pakora is very nice, so I can recommend the pakora.
Thank you all again, and you came on a very
thank you
short
so
notice.
Much. Yeah.
And I also want to thank the Honourable Minister and my dear friend for not only being here, but he will be here in the future. But I can tell you one thing, he's very passionate, hardworking, and one of the fellows that is very well respected in the hallways of Parliament, the experience that he brings and the passion that he brings. Mark, looking forward to seeing you many more times.
Thank you, sir.
Mr. Taliwal, thank you for bringing Minister of Health, Mr. Mark Holland, here to talk to Punjabi Press Club. ਤੁਸੀਂ ਉਹਨਾਂ ਨਾਲ 2 ਦਿਨਾਂ ਦੇ ਨਾਲ ਤੁਸੀਂ ਇਹਨਾਂ ਦੇ ਫਿਰ ਰਹੇ ਮਿਨਿਸਟਰ ਨਾਲ ਤੁਹਾਨੂੰ ਆਪਣੇ ਹੈਲਥ ਕੇਅਰ ਬਾਰੇ ਜਿਹੜੇ ਚੈਲੰਜਸ ਹੈ considering your daughters are in a health care and how you feel?
देखो सानू पहली गल तो यह हैगी भी सरी फास्टैसट ग्रोइंग म्यूनसिपैलिटी हैगी सी कम्यूनिटीज़ हैगी और मिनिस्टर ਜਿਹੜੇ मार्क हॉलैंड बहुत लम्मा एक्सपीरियंस है इन्हों का 2004 पहली बार इलैक्ट होए ਇੰਨੀਆਂ ਟਰਮਸ ਤੋਂ ਬਾਅਦ ਚਾਹੇ ਉਹ ਵਿਪ ਰਹੇ ਚਾਹੇ ਉਹ ਹਾਊਸ ਲੀਡਰ ਰਹੇ ਅੱਜ ਉਹ ਮਿਨਿਸਟਰ ਨੇ ਬੜੇ ਪੈਸ਼ਨੇਟ ਨੇ ਔਰ ਵੈਰੀ ਵੈਲ ਰਿਸਪੈਕਟਡ ਹੈਗੇ ਜਿੱਦਾਂ ਮੈਂ ਪਹਿਲਾਂ ਦੱਸਿਆ ਔਰ ਇਹ ਇੱਕ ਇਹਨਾਂ ਨੇ ਕਮਿਟਮੈਂਟ ਕੀਤੀ ਕਿ ਇਹ ਪਹਿਲੀ ਵਾਰ ਜਦੋਂ ਆਏ ਆ ਪਹਿਲੀ ਵਾਰੀ ਸਰੀ 'ਚ ਆਏ ਔਰ ਪਹਿਲਾ ਹੀ ਦੌਰਾ ਨਹੀਂ ਫਿਰ ਵੀ ਸਰੀ ਦੇ ਵਿੱਚ ਆਉਣਗੇ ਕਿਉਂਕਿ ਉਹ ਕੰਸਰਨਡ ਹੈਗੇ ਨੇ ਕਿ ਜਿਹੜਾ ਹੈਲਥ ਕੇਅਰ ਐਸਪੈਕਟ ਸਰੀ ਦੇ ਵਿੱਚ ਹੈਗਾ ਵਨ ਆਫ ਦਾ ਟਾਪ ਇਸ਼ੂਜ਼ ਹੈਗਾ ਉਹਨੂੰ ਕਿਸ ਤਰੀਕੇ ਦੇ ਨਾਲ ਸੂਬੇ ਦੀ ਸਰਕਾਰ ਔਰ ਲੋਕਲ ਗਵਰਨਮੈਂਟਸ ਦੇ ਨਾਲ ਕੰਮ ਕਰਕੇ ਜਿਹੜਾ ਹੈਗਾ ਔਰ ਇੰਡੀਜਨਸ ਸਾਡੀਆਂ ਗਵਰਨਮੈਂਟ ਜਿਹੜੀਆਂ ਹੈਗੀਆਂ ਉਹਨਾਂ ਨਾਲ ਜਿਹੜਾ ਇਹਨੂੰ ਅਸੀਂ ਜਿਹੜਾ ਸਿਰੇ ਚਾੜ ਸਕਦੇ ਹੈਗੇ
ਮਿਸਟਰ ਧਾਲੀਵਾਲ ਆਈ ਅੰਡਰਸਟੈਂਡ ਜਿਹੜੇ ਫੈਡਰਲ ਗਵਰਨਮੈਂਟ ਹੈ ਉਹਨਾਂ ਨੇ ਹੈਲਥ ਪਾਲਿਸੀ ਬਣਾਉਣੀ ਹੈ ਤੇ ਡਿਲੀਵਰ ਜਿਹੜੀ ਹੈ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਗਵਰਨਮੈਂਟ ਨੇ ਕਰਨੀ ਹੈ ਇੱਥੇ ਜਿਹੜੇ ਲੋਕੀ ਆਪਣੇ BC ਦੇ ਵਿੱਚ ਹੈ ਯੂਅਰ ਮੈਂਬਰ ਆਫ ਪਾਰਲੀਮੈਂਟ ਫॉर ਸਰੀ ਨਿਊਟਨ ਇੱਥੇ ਲੋਕੀ ਫੀਲ ਕਰ ਰਿਹਾ ਹੈ ਕਿ ਹੈਲਥ ਕੇਅਰ ਸਿਸਟਮ ਇਜ਼ ਬ੍ਰੋਕਨ ਥੋੜਾ ਇਸ ਬਾਰੇ ਕੀ ਖਿਆਲ ਹੈ
ਦੇਖੋ ਚੈਲੰਜਸ ਆਪਾਂ ਫੇਸ ਕਰ ਰਹੇ ਹੈਗੇ ਠੀਕ ਹੈ ਨਾ ਇਹ ਈਜ਼ੀ ਹੈਗਾ ਕਹਿ ਦੇਣਾ ਵੀ ਸਿਸਟਮ ਬ੍ਰੋਕਨ ਹੈਗਾ ਕਿਉਂਕਿ ਚੈਲੰਜ ਅਸੀਂ ਫੇਸ ਕਰ ਰਹੇ ਜਿਸ ਤਰ੍ਹਾਂ ਦੱਸਿਆ ਇੱਕ ਗਰੋਇੰਗ ਐਲਡਰਲੀ ਪਾਪੂਲੇਸ਼ਨ ਹੈਗੀ ਸਸਟੇਨ ਕਰਨ ਵਾਸਤੇ ਵੱਡੀ ਪਾਪੂਲੇਸ਼ਨ ਸਾਨੂੰ ਇਮੀਗ੍ਰੈਂਟ ਦੀ ਉਹ ਵੀ ਬਾਹਰੋਂ ਲਿਆਉਣੀ ਪੈ ਰਹੀ ਹੈ ਅੱਜ ਇਸ ਇਕਨੋਮੀ ਨੂੰ ਸਪੋਰਟ ਕਰਨਾ ਸੋ ਜਦੋਂ ਉਹ ਚੀਜ਼ ਹੈ ਉਹਦੇ ਲਈ ਅਸੀਂ ਸਰਵਿਸਿਜ਼ ਵੀ ਪ੍ਰੋਵਾਈਡ ਕਰਨੀ ਔਰ ਮੈਜੋਰਿਟੀ ਆਫ ਦਾ ਪੀਪਲ ਜਿਹੜੇ ਮੂਵ ਹੋ ਰਹੇ ਆ ਉਹ ਸਰੀ 'ਚ ਮੂਵ ਹੋ ਰਹੇ ਆ ਸੋ ਮੇਨ ਜਿਹੜਾ ਫੋਕਸ ਹੈਗਾ ਕਿ ਚਾਹੇ ਇਹ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਜੁਡੀਡੀਕਸ਼ਨ ਹੈਗੀ ਉਹਨਾਂ ਮਿਨਿਸਟਰ ਨੇ ਕਿਹਾ ਵੀ ਅਸੀਂ ਜੁਡੀਡੀਕਸ਼ਨ 'ਚ ਨਹੀਂ ਪੈਣਾ ਹੈਗਾ ਉਹ ਕਹਿੰਦੇ ਨੇ ਕਿ ਅਸੀਂ ਜਿਹੜਾ ਹੈਗਾ ਕੰਮ ਕਰਨਾ ਇਕੱਠਿਆਂ ਹੋ ਕੇ ਦੂਜੀਆਂ ਸਰਕਾਰਾਂ ਦੇ ਨਾਲ ਤਾਂ ਕਿ ਜਿਹੜਾ ਇਹ ਸਿਸਟਮ ਚੈਲੰਜਸ ਫੇਸ ਕਰ ਰਿਹਾ ਵਾ ਹੈਲਥ ਕੇਅਰ ਦੇ ਵਿੱਚ ਉਹ ਜਿਹੜੇ ਨੇ ਉਹਨੂੰ ਅਸੀਂ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਰਿਜ਼ੋਲਵ ਕਰਨਾ ਮੈਂ ਇਹ ਕਹਿੰਦਾ ਵੀ ਮਿਨਿਸਟਰ ਬਣਨ ਤੋਂ ਇਮੀਡੀਏਟਲੀ ਜਿਹੜਾ ਇੱਥੇ ਆਉਣਾ BC ਦੇ ਵਿੱਚ ਚਾਹੇ ਉਹ ਹਸਪੀਟਲ ਆ ਚਾਹੇ ਉਹ ਮਿਨਿਸਟਰ ਦੇ ਨਾਲ ਮੀਟਿੰਗ ਆ ਚਾਹੇ ਅੱਜ ਪੰਜਾਬੀ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਦੇ ਨਾਲ ਉਹਨਾਂ ਨੇ ਮੀਟਿੰਗ ਕਰਨੀ ਇਹ ਸ਼ੋਅ ਕਰਦਾ ਕਿ ਮਿਨਿਸਟਰ ਹੌਲੈਂਡ ਜਿਹੜੇ ਹੈਗੇ ਆ ਉਹ ਇਸ ਇਸ਼ੂ ਨੂੰ ਜਿਹੜਾ ਹੈਗਾ ਉਹ ਅਗਲੇ ਲੈਵਲ 'ਤੇ ਲਿਜਾ ਕੇ ਜਿਹੜਾ ਹੈਗਾ ਉਹਨੂੰ ਸੋਲਵ ਕਰਨ ਲਈ ਤਤਪਰ ਹੈਗੇ
ਮਿਸਟਰ ਧਾਲੀਵਾਲ ਮਾਈ ਲਾਸਟ ਕੁਐਸਚਨ ਤੁਹਾਨੂੰ ਪਤਾ ਕਿ ਨਿਊ ਇਮੀਗ੍ਰੈਂਟਸ ਆ ਰਹੇ ਐਂਡ ਤੁਸੀਂ ਜਿਵੇਂ ਕਿਹਾ ਕਿ ਜਿਹੜੇ ਬੇਬੀ ਬੂਮਰਸ ਆ ਉਹ ਦੇ ਆਰ ਗੈਟਿੰਗ 올ਡਰ ਹੈਲਥ ਕੇਅਰ 'ਤੇ ਬੜਾ ਸਟ੍ਰੈਸ ਹੈ ਹਾਊ ਔਨ ਦਾ ਐਜੂਕੇਸ਼ਨ ਪਾਰਟ ਐਂਡ ਪ੍ਰੀਵੈਂਸ਼ਨ ਜਿਹੜੇ ਨਿਊ ਇਮੀਗ੍ਰੈਂਟਸ ਉਹਦੇ ਲਈ ਆਪਾਂ ਕੀ ਉਪਰਾਲੇ ਕਰ ਸਕਦੇ ਹਾਂ ਤਾਂ ਕਿ ਲੋਕੀ ਛੋਟੀਆਂ ਮੋਟੀਆਂ ਜਿਹੜੀਆਂ ਬਿਮਾਰੀਆਂ ਜ਼ੁਕਾਮ ਫਲੂ ਦਿਸ ਐਂਡ ਦੈਟ ਐਮਰਜੈਂਸੀ ਨਾ ਜਾਣ ਤਾਂ ਕਿ ਜਿਹੜੇ ਪਹਿਲਾਂ ਕੁਐਸਚਨ ਆਏ ਸੀ ਵੀ 10-10 ਘੰਟੇ ਵੇਟ ਨਾ ਕਰਨੀ ਪਵੇ
ਦੇਖੋ ਉਹਦੇ ਲਈ ਇਹ ਹੈਗਾ ਜਿਸ ਤਰ੍ਹਾਂ ਮਿਨਿਸਟਰ ਨੇ ਪਹਿਲਾਂ ਕਿਹਾ ਵੀ ਸਾਨੂੰ ਇਕੱਠੇ ਹੋ ਕੇ ਕੰਮ ਕਰਨਾ ਪੈਣਾ ਕਮਿਊਨਿਟੀ ਆਰਗੇਨਾਈਜੇਸ਼ਨਸ ਨੇ ਜਾਂ ਜਿਹੜੇ ਹੈਗੇ ਉਹਦੇ ਵਿੱਚ ਚਾਹੇ ਉਹ ਅੱਜ ਕੈਂਸਰ ਦੀ ਗੱਲ ਕਰ ਲਈਏ ਚਾਹੇ ਉਹ ਹਾਰਟ ਡਿਜ਼ੀਜ਼ ਸਾਡੀ ਕਮਿਊਨਿਟੀ 'ਚ ਬੜੀ ਕਾਮਨ ਹੈਗੀ ਉਹਦੇ ਵਿੱਚ ਬਹੁਤ ਸਾਰੀਆਂ ਔਰ ਮੈਂਟਲ ਹੈਲਥ ਹੈਗਾ ਔਰ ਬਹੁਤ ਸਾਰੀਆਂ ਸੰਸਥਾਵਾਂ ਜਿਹੜੀਆਂ ਨੇ ਉਹ ਕੰਮ ਕਰ ਰਹੀਆਂ ਪਰ ਸਾਨੂੰ ਇਨਕਰੇਜ ਕਰਨਾ ਪੈਣਾ ਵੀ ਜਿੱਥੇ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੋਵਾਈਡਰ ਜਿਹੜੇ ਆ ਉਹ ਹੈਲਪ ਕਰਦੇ ਜਿੱਥੇ ਪ੍ਰੀਵੈਂਸ਼ਨ ਦੀ ਗੱਲ ਆਉਂਦੀ ਆ ਉੱਥੇ ਚਾਹੇ ਉਹ ਸਪੋਰਟਸ ਆ ਚਾਹੇ ਉਹ ਕਮਿਊਨਿਟੀ ਆਰਗੇਨਾਈਜੇਸ਼ਨ ਅਸੀਂ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਜਿਹੜਾ ਹੈਗਾ ਇੱਕ ਵਾਰਤਾਲਾਪ ਕਰ ਸਕਦੇ ਹਾਂ ਤਾਂ ਕਿ ਅਸੀਂ ਜਿਹੜਾ ਹੈਗਾ ਇਹ ਚੀਜ਼ ਨੂੰ ਜਿਹੜਾ ਹੈਗਾ ਉੱਧਰ ਨੂੰ ਅਸੀਂ ਜਾ ਸਕੀਏ ਲੋਕਾਂ ਦੀ ਜਿਹੜੀ ਜ਼ਿੰਦਗੀ ਆ ਉਹਨੂੰ ਬਚਾਉਣ ਵਾਸਤੇ ਜਿਹੜੀਆਂ ਨੇ ਹਰ ਇੱਕ ਇਨਸਾਨ ਜਿਹੜਾ ਨਾ ਕਿ ਅਸੀਂ ਜਿਹੜਾ ਇਸ ਨੂੰ ਇਹ ਲਈਏ ਗੁੱਸੇ 'ਚ ਲਈਏ ਐਂਗਰ 'ਚ ਲਈਏ ਪਰ ਇਨਫੈਕਟ ਉਹਨੂੰ ਪਿਆਰ ਦੇ ਨਾਲ ਜਿਹੜਾ ਹੈਗਾ ਬਹੁਤ ਸਾਰੇ ਇਸ਼ੂ ਜਿਹੜੇ ਆ ਉਹ ਰਿਜ਼ੋਲਵ ਹੋ ਸਕਦੇ
ਥੈਂਕ ਯੂ
ਮਿਹਰਬਾਨੀ
Minister, welcome to Surrey once again.
Appreciate
and it's a lot of, it's a difficult file that you got as a health minister.
Yes.
I know that there is challenges that not federally and especially your province of Ontario and British Columbia. In British Columbia, a lot of people feeling, even that's a local jurisdiction, they're feeling that system is broken. What are your take on that?
Well, I understand that people are frustrated. But the reality is we have an incredible healthcare system that is there for Canadians in a myriad ways, and that provinces are facing challenges, but we're here to help as a federal government. We've announced $200 billion that is going to be injected into the health system over the next number of years, and we've specifically said it's not enough to put the money, we have to show the improvement of results. So that means that we have to see improvements across specific metrics, and we're actually going to show, how do we improve health outcomes, how do we reduce wait times, How do we make sure people have better care and use in empirical data, show them exactly, you know, what, where it was and where it's going, and have reporting and accountability year over year for that. So we're working very closely with provinces who deliver healthcare services to be a partner for them, not just in dollars, but in helping to develop these metrics. And it's essential that patients feel that they feel the improvement, the better outcomes in terms of their health outcomes, and a reduction of the burden that they feel often when you don't have positive health outcomes.
So, Minister, we talked about credentials and shortage of doctors, nurses in Ontario and British Columbia especially, the large provinces. How are you planning on addressing that? Because, you know, it can be opening medical colleges will be nice, or nursing college, but this is a long term. Short term, when we have Canadian kids coming with the credentials already, how we speed up that process?
So one of the things, of course, recognizing credentials is a challenge, because it's not just the provinces, but there's also the bodies that are responsible for credentials that we have to work with. So we want to be a conveyor of eliminating these barriers, eliminating them interprovincially, and also getting folks who have foreign credentials to be recognized as quickly as possible, while still making sure that obviously they're ready to practice safely here in Canada. And that's part of the solution, and that's part of the dollars that you see that we're putting forward in the action plans that we're doing, absolutely addressing that, opening up the number of spots that are available for doctors, and opening up the number of spots for students who want to get into medicine as well as dealing with the interprovincial mobility issues, and then also new technology. And also, as I was talking earlier, opening up some of the people who might be able to deliver healthcare services who aren't traditional deliverers of healthcare. So I'm talking with my provincial counterparts about all of these solutions, but certainly the workforce issues, when I talk to health ministers in provinces and territories across the country, this is at the front of all their minds, and it's certainly at the front of our discussion for solutions.
My last question is, after COVID, the mental health issue has gone skyrocketed. Right. And we talked about in a press conference, the opioid crisis. In British Columbia, we're losing 6 people a day. Yes. And it's our national problem. Actually, it's an international problem. How are we addressing that?
Well, I think you're absolutely right to make the connection between the rise in problems with mental health and the rise in problems with dependence on drugs. Those two are absolutely correlated. So there's a number of things we can do related to science and data for folks who are addicted to opioids now to make sure they don't die, and that we can keep them alive well enough to treat them and get them to care. And so that's what we're working with provinces on one hand, and then the other hand, go further upstream. Look at the reasons why somebody's getting addicted to opioids overall, and build community supports to help people so that they get the support and care that they need before they make the disastrous decision to self-medicate with drugs. And because that, as you know and as you say, leads to terrible and disastrous consequences.
Your final comments, Minister.
Well, I just want to say what a pleasure it is to be here in Surrey. This is a community with so much potential that's contributing enormously to our country. I look forward to being back very soon and to continuing to collaborate with local partners here on finding answers and improving healthcare.
Thank you very much.
Thank you so much. Appreciate it.
Ajay, Minister of Health, Federal Minister of Health, Mr. Mark Holland, Punjabi Press Club ਤੇ ਆਏ ਸੀਗੇ। ਉੱਥੇ ਬਹੁਤ ਹੀ ਕੁਐਸਚਨ ਉਹਨਾਂ ਨੂੰ ਪੁੱਛੇ ਗਏ, ਜਿਹੜਾ ਕਿ ਹੈਲਥ ਕੇਅਰ ਸਿਸਟਮ ਕੈਨੇਡਾ ਦਾ ਜਿਹੜਾ ਹੈਗਾ ਉਹ ਫੇਸ ਕਰ ਰਿਹਾ, ਜਿਹੜੇ ਹੈਲਥ ਕੇਅਰ ਦੇ ਚੈਲੰਜਸ ਹੈ, ਜਿਹੜੇ ਵੇਟ ਟਾਈਮਸ ਹੈ ਉਹ ਕਾਫੀ ਵੱਧ ਰਹੇ ਹੈ, ਉਸ ਦੇ ਨਾਲ ਜਿਹੜੇ ਚੈਲੰਜਸ ਹੈ ਡਾਕਟਰ ਤੇ ਨਰਸਿਸ ਦੀ ਸ਼ਾਰਟੇਜ ਹੈ। ਸੋ ਇਸ ਬਾਰੇ ਕਾਫੀ ਖੁੱਲ੍ਹੀ ਉਹਨਾਂ ਨਾਲ ਡਿਸਕਸ਼ਨ ਹੋਈ। ਹਾਲਾਂਕਿ ਉਹ 26 ਜੁਲਾਈ ਨੂੰ 2023 ਮਿਨਿਸਟਰ ਆਫ ਹੈਲਥ ਬਣੇ ਹੈ, ਪਰ ਇਹਨਾਂ ਨੂੰ ਕਾਫੀ ਐਕਸਪੀਰੀਅੰਸ ਹੈਗਾ ਆ ਐਜ਼ ਏ ਮੈਂਬਰ ਆਫ ਪਾਰਲੀਮੈਂਟ, ਉਸ ਤੋਂ ਪਹਿਲਾਂ ਐਜ਼ ਏ ਕਾਉਂਸਲਰ ਐਂਡ ਦੈਨ ਸਰਵਿੰਗ ਕਪਲ ਆਫ ਪੋਰਟਫੋਲੀਓਜ਼। ਸੋ ਉਹਨਾਂ ਨੇ ਬੜੇ ਹੀ ਵਧੀਆ ਤਰੀਕੇ ਨਾਲ ਇਸ ਗੱਲਾਂ ਦਾ ਜਵਾਬ ਦਿੱਤਾ ਆ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਹਾਲਾਂਕਿ ਫੈਡਰਲ ਗੌਰਮੈਂਟ ਦੀ ਜੌਬ ਹੈਗੀ ਆ ਪਾਲਿਸੀ ਫਾਰਮੇਸ਼ਨ ਐਂਡ ਫੰਡਿੰਗ, ਐਂਡ ਦੈਨ ਜਿਹੜੀ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਗੌਰਮੈਂਟ ਹੈ ਉਹ ਜਿਹੜਾ ਹੈਲਥ ਕੇਅਰ ਸਿਸਟਮ ਹਰ ਪ੍ਰੋਵਿੰਸ ਦੇ ਵਿੱਚ ਰਨ ਕਰਦੀ ਹੈ। ਸੋ ਇਸੇ ਹੀ ਤਰ੍ਹਾਂ ਦੇਖਦੇ ਰਿਹਾ ਕਰੋ ਸਾਂਝਾ TV, ਪ੍ਰੋਫੈਸਰ CJ ਸਿੱਧੂ ਸ਼ੋ ਐਵਰੀ ਥਰਸਡੇ 7 to 8 o'clock। ਧੰਨਵਾਦ, ਰੱਬ ਰੱਖਾ, ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ।